1. What is the priority nursing action for an asthma patient in acute distress? A. Administer a bronchodilator. B. Encourage pursed lip breathing. C. Provide ice chips for comfort. D. Initiate chest physiotherapy. Answer: A. Administer a bronchodilator. Rationale: the priority intervention for an asthma patient in acute distress is to administer a bronchodilator, such as a short-acting beta agonist, SABA, to relieve bronchospasm. Encouraging pursed lip breathing, B, can help but is not the priority. Providing ice chips, C, has no impact on airway constriction. Chest physiotherapy, D, is not recommended in acute asthma attacks. 2. A patient with asthma is prescribed a long-acting beta agonist, LABA. What should the nurse include in the patient teaching? A. Use this medication during an acute attack. B. This medication helps to control your asthma long-term. C. LABAs replace the need for inhaled steroids. D. You should take this medication only as needed. Answer: B. This medication helps to control your asthma long-term. Rationale: LABAs, such as salmeterol, are used for long-term control and prevention of asthma symptoms. They are not used for acute attacks. A. LABAs do not replace inhaled corticosteroids, C, but are often used in combination. They should be taken regularly, not just as needed, D. 3. A nurse is assessing a patient experiencing an asthma exacerbation. Which finding indicates that the patient is deteriorating? A. Loud wheezing. B. Increased respiratory effort with silent chest. C. Increased mucus production. D. Coughing with expectoration. Answer: B. Increased respiratory effort with silent chest. Rationale: a silent chest, B, in a patient with an asthma exacerbation indicates severe airway obstruction and impending respiratory failure. Loud wheezing, A, suggests bronchospasm, but is not as critical. Increased mucus production, C, and coughing with expectoration, D, are common in asthma but do not indicate immediate deterioration. 4. The nurse is educating a patient about using a metered-dose inhaler, MDI, with a spacer. Which instructions should be included? A. Exhale fully, then inhale quickly after pressing the inhaler. B. Shake the inhaler, press it, and inhale slowly and deeply. C. Take 2 puffs at once for better effect. D. Do not shake the inhaler before use. Answer: B. Shake the inhaler, press it, and inhale slowly and deeply. Rationale: shaking the inhaler before use ensures even medication distribution. Inhaling slowly and deeply allows proper deposition in the lungs. Exhaling fully before inhalation is correct but must be followed by slow inhalation, not rapid, A. Taking 2 puffs at once, C, is incorrect. Each puff should be taken separately. Not shaking the inhaler, D, may result in uneven medication delivery. 5. A patient having an acute asthma attack is not responding to a short-acting beta agonist, SABA. What is the next best nursing action? A. Administer a corticosteroid. B. Increase the dose of SABA. C. Encourage deep breathing. D. Apply a cold compress. Answer: A. Administer a corticosteroid. Rationale: when a patient does not respond to a SABA, systemic corticosteroids, A, are administered to reduce inflammation. Increasing the dose of SABA, B, may not be effective. Encouraging deep breathing, C, does not address the underlying inflammation. Cold compresses, D, do not have a role in asthma management. 6. A patient with asthma is prescribed an inhaled corticosteroid. What is the most important teaching point for the nurse to emphasize? A. Use this medication during an acute asthma attack. B. Rinse your mouth after each use to prevent infection. C. Stop taking this medication once symptoms improve. D. Shake the inhaler before each dose. Answer: B. Rinse your mouth after each use to prevent infection. Rationale: inhaled corticosteroids can cause oral candidiasis, thrush. Rinsing the mouth prevents this. They should not be used for acute attacks. A. The medication must be taken regularly, even when symptoms improve. C. While shaking the inhaler, D, is necessary for some medications, it is not the most critical point. 7. A patient is prescribed Monteliacast, singular, for asthma management. When should the nurse instruct the patient to take this medication? A. During an acute asthma attack. B. Only when experiencing symptoms. C. Every evening for long-term control. D. Before using a rescue inhaler. Answer: C. Every evening for long-term control. Rationale: Monteliacast is a leukotriene receptor antagonist used for long-term asthma control and is taken daily in the evening. It is not for acute attacks. A. And should not be used only when symptoms appear. B. It does not need to be taken before a rescue inhaler. D. 8. A patient experiencing an asthma attack has a PaCO2 level of 48 millimeters of mercury. What does this indicate? A. The patient is hyperventilating. B. The patient is retaining carbon dioxide, indicating worsening status. C. The asthma attack is resolving. D. The patient is at risk for respiratory alkalosis. Answer: B. The patient is retaining carbon dioxide, indicating worsening status. Rationale: a PaCO2 greater than 45 millimeters of mercury in an asthma patient suggests impending respiratory failure due to air trapping and inadequate gas exchange. Hyperventilation: A. Typically causes low PaCO2. Resolution of an asthma attack, C. Would normalize gases. Increased CO2 retention leads to respiratory acidosis, not alkalosis. D. 9. Which of the following is the strongest risk factor for developing asthma? A. Family history of asthma. B. Sedentary lifestyle. C. Vitamin D deficiency. D. High sodium diet. Answer: A. Family history of asthma. Rationale: genetics play a significant role in asthma development. A sedentary lifestyle, B. Vitamin D deficiency, C. And high sodium diets, D. Do not have a direct or primary link to asthma risk. 10. A nurse is assessing a patient with asthma. Which symptom indicates impending respiratory failure? A. Audible wheezing. B. Speaking in short phrases. C. Productive cough. D. Increased mucus production. Answer: B. Speaking in short phrases. Rationale: when a patient can only speak in short phrases or single words, it indicates severe respiratory distress and potential failure. Audible wheezing: A. Suggests airway constriction but not necessarily failure. Productive cough, C. And mucus production, D. Are common in asthma but not indicators of respiratory failure. 11. Which statement by a patient with asthma indicates a need for further education? A. I will use my rescue inhaler when I have shortness of breath. B. I should use my steroid inhaler first, then my bronchodilator. C. I should avoid my asthma triggers as much as possible. D. I will monitor my peak flow readings daily. Answer: B. I should use my steroid inhaler first, then my bronchodilator. Rationale: bronchodilators, e.g., SABAs, should be used first to open the airways before inhaled corticosteroids. Using a steroid first, B. Reduces effectiveness. Other statements, A, C, and D, reflect appropriate asthma management. 12. A patient with severe asthma is prescribed theophylline. What should the nurse monitor for? A. Increased urination. B. Signs of toxicity, such as nausea and tremors. C. Weight gain. D. Drowsiness. Answer: B. Signs of toxicity, such as nausea and tremors. Rationale: theophylline has a narrow therapeutic index and toxicity can cause nausea, tremors, and tachycardia. It does not cause increased urination, A. Weight gain, C. Or drowsiness, D. 13. A child with asthma uses a peak flow meter daily. Which reading indicates the need for immediate medical intervention? A. 80 to 100% of personal best. B. 50 to 79% of personal best. C. Below 50% of personal best. D. 60 to 80% of personal best. Answer: C. Below 50% of personal best. Rationale: A peak flow reading below 50% indicates a medical emergency requiring immediate intervention. 80 to 100%, A, is in the green zone, controlled asthma. 50 to 79%, B, suggests caution but not an emergency. 14. A nurse is teaching a patient about albuterol, Preventol. Which side effect should the patient be warned about? A, fatigue. B, hypotension. C, tachycardia and tremors. D, constipation. Answer: C, tachycardia and tremors. Rationale: albuterol is a beta agonist that can cause tachycardia, tremors, and palpitations. It does not typically cause fatigue, A, hypotension, B, or constipation, D. 15. What is the most effective way to confirm an asthma diagnosis? A, chest X-ray. B, peak expiratory flow rate, PFR. C, pulmonary function tests, PFTs. D, pulse oximetry. Answer: C, pulmonary function tests, PFTs. Rationale: PFTs, including spirometry, are the gold standard for diagnosing asthma. A chest X-ray, A, does not diagnose asthma. PFR, B, monitors severity, but is not diagnostic. Pulse oximetry, D, assesses oxygenation, but does not confirm asthma. 16. A patient with asthma reports using their albuterol inhaler multiple times per day. What should the nurse do first? A, encourage the patient to use the inhaler as needed. B, assess the patient's asthma control and medication adherence. C, increase the albuterol dosage. D, suggest switching to a different rescue inhaler. Answer: B, assess the patient's asthma control and medication adherence. Rationale: frequent use of a rescue inhaler suggests poor asthma control, requiring reassessment. Encouraging more use, A, is unsafe. Increasing the dosage, C, or switching inhalers, D, is inappropriate without proper evaluation. 17. What is the primary action of a short-acting beta agonist, SABA, like albuterol? A, reduce airway inflammation. B, provide immediate bronchodilation. C, prevent asthma exacerbations. D, thin mucus secretions. Answer: B, provide immediate bronchodilation. Rationale: SABAs like albuterol work by rapidly relaxing bronchial smooth muscle for immediate symptom relief. They do not reduce inflammation, A, prevent future exacerbations, C, or affect mucus production, D. 18. A patient experiencing an asthma exacerbation has a silent chest and absent wheezing. What should the nurse do next? A, document findings as improvement. B, reassess the patient in 15 minutes. C, prepare for emergency intubation. D, administer an oral corticosteroid. Answer: C, prepare for emergency intubation. Rationale: a silent chest indicates severe airway obstruction and possible respiratory failure. Immediate intervention, C, is necessary. Lack of wheezing is not an improvement, A, waiting, B, is unsafe, and oral corticosteroids, D, take time to act. 19. A nurse teaches a patient about peak flow meter use. Which statement indicates correct understanding? A, I should use it after taking my medication. B, I should use it when I feel short of breath. C, I should use it at the same time each day. D, I should exhale slowly into the device. Answer: C, I should use it at the same time each day. Rationale: peak flow monitoring is most accurate when done at the same time daily. It should be used before medication, A, not only during symptoms, B. The patient should exhale forcefully, not slowly, D. 20. A patient with severe asthma is prescribed prednisone. What is a key teaching point? A, take this medication on an empty stomach. B, you may stop taking this medication once symptoms improve. C, avoid people who are sick while on this medication. D, expect increased urine output while taking this medication. Answer: C, avoid people who are sick while on this medication. Rationale: prednisone suppresses the immune system, increasing infection risk. It should be taken with food, A, and never stopped abruptly, B. It does not cause increased urination, D. 21. A patient is prescribed salmeterol for asthma. What should the nurse include in the teaching? A. Use this medication for quick relief of symptoms. B. Take this medication every morning and evening. C. This medication can be used as a substitute for your inhaled corticosteroid. D. Only use this medication when needed. Answer. B. Take this medication every morning and evening. Rationale: salmeterol is a long-acting beta-agonist, LABA, used twice daily for maintenance. It is not for quick relief, A, and should not replace corticosteroids, C. It is taken regularly, not as needed, D. 22. A patient with asthma reports new-onset hoarseness and white patches in their mouth. What is the likely cause? A. Poor oral hygiene. B. Inhaled corticosteroid use. C. Viral infection. D. Dehydration. Answer. B. Inhaled corticosteroid use. Rationale: inhaled corticosteroids can cause oral candidiasis, thrush, leading to hoarseness and white patches. Proper mouth rinsing is essential. Poor hygiene, A. Viral infections, C. Or dehydration, D. are less likely causes. 23. Which statement by a patient indicates correct understanding of asthma triggers? A. I should avoid exercising to prevent attacks. B. Cold air and strong odors can trigger my asthma. C. Eating spicy foods can cause an asthma attack. D. Drinking more water will prevent asthma attacks. Answer. B. Cold air and strong odors can trigger my asthma. Rationale: cold air, strong odors, pollen, and smoke are common asthma triggers. Exercise is encouraged with proper management, A. Spicy foods, C, and hydration, D. do not directly prevent asthma attacks. 24. A nurse assesses a patient using accessory muscles to breathe with nasal flaring. What is the priority action? A. Check the patient's oxygen saturation. B. Encourage the patient to drink fluids. C. Instruct the patient to breathe slowly. D. Administer an oral corticosteroid. Answer. A. Check the patient's oxygen saturation. Rationale: accessory muscle use and nasal flaring suggest respiratory distress. The priority is to assess oxygenation, A. Encouraging fluids, B, and slow breathing, C, are not initial actions. Corticosteroids, D, take time to work. 25. Which intervention is most effective for preventing asthma-related hospitalizations? A. Using a humidifier at home. B. Taking prescribed daily medications correctly. C. Avoiding exercise. D. Drinking herbal tea. Answer. B. Taking prescribed daily medications correctly. Rationale: adherence to controller medications, e.g., inhaled corticosteroids, LABAs, prevents exacerbations. Humidifiers, A, can worsen asthma. Avoiding exercise, C, is unnecessary. Herbal remedies, D, lacks scientific support. 26. A patient with asthma reports waking up at night due to coughing. What does this indicate? A. Well-controlled asthma. B. Need for medication adjustment. C. Normal response to asthma. D. Anxiety-related symptoms. Answer. B. Need for medication adjustment. Rationale: nocturnal symptoms indicate poor asthma control and the need for medication changes. Well-controlled asthma, A, should not cause nighttime symptoms. It is not a normal response, C, or due to anxiety, D. 27. A patient is having an asthma attack, but does not have a rescue inhaler. What should the nurse instruct the patient to do? A. Lie down and rest. B. Take slow, deep breaths and sit upright. C. Drink cold water. D. Perform pursed lip breathing. Answer. B. Take slow, deep breaths and sit upright. Rationale: sitting upright and controlling breathing helps improve airflow. Lying down, A, worsens breathing. Cold water, C, has no proven benefit. Pursed lip breathing, D, is more effective for COPD than asthma. 28. What is the main purpose of Montelycast in asthma treatment? A. Provide immediate relief of asthma symptoms. B. Reduce airway inflammation over time. C. Replace inhaled corticosteroids. D. Work as a rescue inhaler. Answer. B. Reduce airway inflammation over time. Rationale. Montelycast is a leukotriene receptor antagonist that helps prevent inflammation and asthma symptoms. It does not provide immediate relief. A. Cannot replace corticosteroids. C. And is not a rescue inhaler. D. 29. What should a patient do after using an inhaled corticosteroid? A. Drink a glass of milk. B. Rinse their mouth with water. C. Take deep breaths. D. Avoid eating for 30 minutes. Answer. B. Rinse their mouth with water. Rationale. Inhaled corticosteroids can cause oral thrush, so patients should rinse their mouths to prevent fungal infections. Drinking milk. A. Does not help. Taking deep breaths. C. Is unrelated, and avoiding food. D. Is unnecessary. 30. Which sign indicates a life-threatening asthma exacerbation? A. Silent chest. B. Wheezing. C. Coughing. D. Tachypnea. Answer. A. Silent chest. Rationale. A silent chest occurs when airflow is so restricted that wheezing disappears, indicating impending respiratory failure. Wheezing. B. Is common in asthma but not as dangerous. Coughing. C. And tachypnea. D. Are early symptoms but do not indicate impending respiratory arrest. 31. Which of the following is the primary action of a short-acting beta agonist, SABA, during an asthma attack? A. Reduce inflammation in the airways. B. Open the airways by relaxing bronchial muscles. C. Decrease mucus production. D. Increase heart rate and blood pressure. Answer. B. Open the airways by relaxing bronchial muscles. Rationale. SABAs are bronchodilators that provide rapid relief by relaxing the smooth muscles of the airways. They do not reduce inflammation. A. Decrease mucus. C. Or significantly affect heart rate and blood pressure. D. In typical doses. 32. A nurse is teaching a patient about the correct use of a meter-dose inhaler, MDI. Which statement by the patient indicates the need for further teaching? A. I will shake the inhaler before each use. B. I will breathe in slowly as I press down on the inhaler. C. I will hold my breath for 10 seconds after inhaling. D. I will use the inhaler only when I feel short of breath. Answer. D. I will use the inhaler only when I feel short of breath. Rationale. Inhalers should be used regularly as prescribed, even if the patient does not feel short of breath. Shaking the inhaler. A. Breathing in slowly. B. And holding the breath. C. Are correct techniques. 33. Which is a common trigger for asthma exacerbations? A. Cold weather. B. Eating spicy foods. C. Drinking hot beverages. D. Bright sunlight. Answer. A. Cold weather. Rationale. Cold air is a common asthma trigger because it can lead to bronchoconstriction. Spicy foods. B. Hot beverages. C. And bright sunlight. D. Are generally not asthma triggers. 34. What is the primary goal in the treatment of asthma? A. To cure asthma. B. To maintain normal lung function and prevent symptoms. C. To decrease the patient's anxiety. D. To reduce the need for medications. Answer. B. To maintain normal lung function and prevent symptoms. Rationale. The primary goal in asthma management is to control symptoms and maintain normal lung function. Asthma cannot be cured. A. Anxiety control. C. Is not the main focus, and reducing medication. D. Should not be prioritized over controlling asthma. 35. What should a nurse do first when a patient presents with acute respiratory distress due to asthma? A. Administer an intravenous corticosteroid. B. Obtain a pulse oximeter reading. C. Administer a bronchodilator. D. Position the patient flat in bed. Answer. C. Administer a bronchodilator. Rationale. The first priority in acute asthma distress is bronchodilation to relieve the airway constriction. Pulse oximetry, B, and corticosteroid administration, A, follow after bronchodilation. Positioning the patient flat, D, may worsen breathing. 36. Which of the following medications should be avoided in patients with asthma due to its potential to cause bronchoconstriction? A, beta blockers. B, diuretics. C, antihistamines.
D, steroids.
Answer: A, beta blockers. Rationale: beta blockers can cause bronchoconstriction and should generally be avoided in asthma patients. Diuretics, B, antihistamines, C, and steroids, D, do not typically cause bronchoconstriction. 37. Which patient education point is most important for someone with asthma and seasonal allergies? A, to limit outdoor activity during peak pollen season. B, to avoid all physical exercise. C, to take oral antibiotics regularly. D, to use a bronchodilator only during an exacerbation. Answer: A, to limit outdoor activity during peak pollen season. Rationale: pollen is a common asthma trigger for those with both asthma and allergies, so limiting exposure is important. Physical exercise, B, is usually encouraged unless exacerbating symptoms. Antibiotics, C, are not necessary unless there's an infection, and bronchodilators, D, should be used as prescribed, not only during exacerbations. 38. Which of the following is an example of a long-acting beta agonist, LABA, used in asthma management? A, albuterol. B, ipratropium. C, salmeterol.
D, fluticasone.
Answer: C, salmeterol. Rationale: salmeterol is a long-acting beta agonist, LABA, that works to keep airways open for 12 hours or more. Albuterol, A, is a short-acting bronchodilator. Ipratropium, B, is an anticholinergic, and fluticasone, D, is a corticosteroid. 39. A nurse is assessing a patient's asthma control. Which of the following is a sign of poorly controlled asthma? A, minimal nighttime awakenings due to symptoms. B, a peak flow meter reading in the green zone. C, frequent use of a short-acting beta agonist, SABA. D, exercise without experiencing symptoms. Answer: C, frequent use of a short-acting beta agonist, SABA. Rationale: frequent use of a SABA, C, indicates that asthma is not well controlled. Minimal nighttime awakenings, A, green zone peak flow, B, and no symptoms during exercise, D, are signs of good control. 40. A patient with asthma is prescribed a combination inhaler that contains both a corticosteroid and a LABA. What is the role of the corticosteroid in the combination therapy? A, to provide rapid relief of acute asthma symptoms. B, to reduce inflammation and prevent exacerbations. C, to increase airway diameter immediately. D, to prevent viral infections that trigger asthma. Answer: B, to reduce inflammation and prevent exacerbations. Rationale: corticosteroids reduce airway inflammation, which helps prevent exacerbations. LABAs, A, provide long-lasting bronchodilation, and corticosteroids do not provide immediate relief, C, or prevent infections, D.